Hi, good morning. This is part three of the Rise and Fall of Medicine class that Dr. Joel Fivalent and myself, Bharat Pathakji, did at Osher USF Senior Learning. Okay, and we were talking about the good and the bad of modern medicine as to how we have, last time we finished about the problems with overdiagnosis and the benefits of technology. We discussed the slides of amazing advances in computerized scanning. Okay, continuing on the same length, here is a good example of that you can see as to how the major reasons why doctors order tests. And they're pretty self-apparent, type of things. There's a lot of times, the big fear of miss not of just to be on the safe side or just part to know type of thing. And sometimes even the patients ask for CAT scanning type of thing, or they're all of us are fascinated by the new technology type of thing. And obviously, the more tests that you order, there is more benefit. Oh, not necessarily to themselves, but it just sometimes becomes like a reflex type of treatment, and it's a checklist that we follow. Okay, and instead of getting a complete history, it's a lot easier just to order tests, type of thing. So, and many times people don't even look at the one that was done, a few months ago, and you end up getting, So, and again, as I had talked about earlier, the technology has become tremendously sensitive. As you can see, in the old days, the tumor was 2 centimeters, and the modern three-dimensional mammography diagnosis really tiniest tumors. So, or diagnosis is a serious problem. And this is not just in imaging technology, but in other illnesses such as pulmonary embolism. When I was starting residency, we were always told that we were missing the diagnosis of pulmonary embolism. Now everybody who comes in with any shortness of breath, is suspected to have pulmonary emboli and gets a CAT scan. Whether even if it is just due to some simple not a clinical explanation for it, type of thing. So, and again, the screening for abdominal aneurysm has become a big business type of thing, and especially some of the vascular surgeons, they would chase smallest aneurysms. We don't even know what the natural history of this thing is, type of thing. And again, we'll talk more about genetics as to how. On the other hand, we have to give credit to the psychiatric community that they, at one stroke of pen, they cured so many people of a potentially serious disease, which back in the 70s was called homosexuality. So when they modified the disease classification called DSM-5 or whatever that was, at that time, they removed homosexuality as a pathological illness. So, they're clever chaps, obviously. Okay. And again, there's some of the tests, are not exactly quite safe, because now with the technology, radiation has decreased, but still it is something that has to be mentioned because, and there is one report that was called that the radiation that one gets in the lowest dose is anywhere in between 5 to 20 millisievert unit, and that is to some extent equivalent to the that was received by the Japanese survivors of the atomic bomb. So if you end up with multiple CAT scan, you're getting a fairly good dose of radiation, and that is, that's not the problem with MRI scanning, but again, that's a very psychologically trying test for many people. And and then there is even a word for the illnesses that we call cure. It's called iatrogenesis. It's a Greek origin word, means starting from physician or testing. And again, we are not. This is just testing. We're not talking about the drug-induced reactions, adverse drug reactions. That is a whole bag of worms in itself, type of thing. So, and all of you know that even like we mentioned earlier, that if aspirin was introduced in the market, it wouldn't get approved. And then as in cardiology, we were aware of digitalis toxicity. A lot of the antibiotics can cause super infection. So the list is endless of side effects that can be caused. In fact, the great jurist Oliver Wendell Holmes said that all the drugs from materia America were sown in the ocean, the fish would be miserable and the humans happy. So that's a rather cynical way of looking at it, but there you have it. Okay, moving on to the other things that while may have made it tremendous attempts at curing lung infections, including tuberculosis and some of the other pneumonias, we have taken 2 steps forward and backwards. And now, with the advent of modern hygiene and urban living, asthma has exploded in the industrialized world. And here is an example of the prevalence in various ethnic communities, like ranging anywhere from 10% for whatever reasons. Puerto Ricans had a fairly high incidence of prevalence. And the same way, mortality also is, statistics are also substantial. These are prorated, obviously, based on 100,000 people. But again, so one can say that there is no role for genetic diversity, but obviously we can see that there really is type of thing. So, and some African Americans have a higher incidence. This may be due to poverty and crowded situation and living in a more polluted. But they were always thought to have a less response to a common drug called albuterol, which is a bronchodilator. Now, why so much asthma? Because the asthma, as we know, is usually seasonal, pollen and extrinsic and intrinsic asthma, as we were taught. And there are varieties of trigger which are very apparent, from infections, allergen, drugs such as even good old aspirin can aggravate a cold exposure, which you see sometimes in athlete, various chemicals, or sometimes you just cannot find cause. And so this is, and people can grow out of it, as they get older, type of thing. And the usual treatment in the old days was measuring the lung function and treating with agents which dilate the bronchioles, type of thing. And but now there are more specific drugs, which is the so-called targeted therapy of varieties of enzymes that will come, and that some of the asthma drugs are big business type of thing. They're biological agents, and some of them, are, and obviously they're much more specific for the inflammation type of abnormalities, but again can be very expensive and can leave you susceptible to infection as well. So Dupixent is a biological drug. So it's derived from a living cell, so it's difficult to create a generic alternative. And okay, get ready for sticker shock. The average cost, cash price for a 30-day price, is $5,200. So this is not for the faint-hearted by any means. Now, why did all this occur? That is a good reason. This was, we talked about the so-called hygiene hypothesis, that we may have overdone on cleanliness type of thing. And as a physician and specialist in microbial illnesses named Martin Glaser has written a very popular book called Missing Microbes. That, let's zoom in on this slide type of thing if we can, that as some of the infectious diseases have gone down since 1950s, in the 50 years we've made dramatic progress in illnesses such as rheumatic fever, measles, malaria, etc. But at the same time, we look at the right side of the image, you can see that the other illnesses, which are so-called autoimmune or unexplained illnesses, have increased dramatically. Let's just focus on asthma, which has increased substantially. You can see from 100 to 200 has really doubled. And multiple sclerosis, which is a big unknown as to why it occurs in the first place in temperate climates. Similarly, Crohn's disease, which is inflammatory bowel disease that Joel alluded to, has also increased. So, some of the other experts have said, and this may be that our factor is that we are too sterile environment, living in high-rise apartment, living in air conditioning. So the axiom that people have said, let them eat dirt. There is sometimes a cause for preventing asthma is having an older sibling or having a pet. And this was well proven in 2 Amish communities. The one that actually worked on the farm, they had far less incidence. On the other hand, which stayed, the people were isolated and did not work directly on farm exposure. So this is, a big direct delivery. And again, the microbial it's a big this thing, and we are learning tremendous thing about the role of gut microbe, not just for asthma, but for other drugs such as H. pylori. Joel Fibelant, my gastroenterologist colleague, alluded to as a role of ulcer, which was the whole hypothesis was thrown over, and now we know that a bacterium may be playing a role. But again, and the incidence of H. pylori varies between the so-called rich countries and the developing or poor countries. That about everybody has infection. Now, one can say this is a commensal, means has made peace with the human gut, and it's been there. So there must be a reason as to why this organism, bacteria, can survive. And perhaps, we have seen that by eliminating H. pylori, we are seeing a higher incidence of metabolic disorders such as obesity and reflux, esophagitis. So perhaps we may be trading one illness for other by eliminating this bacteria, which has been in our guts since we got out of, as human beings, as we got out of Africa. And again, I just learned this a couple of days ago that Martin Glaser and some of the associates have produced a documentary about, about the invisible extinction, that by eliminating varieties of these microbes in our lung, in our gut, and also in avoiding our vaginal exposure from the time we are born to the adulthood by mothers insistingly on spraying everything with Lysol type of thing, that we may be creating an epidemic, silent, similar to, and again, by overuse of antibiotics, we may be eliminating gut flora. And people who do microbial research have proven some very interesting thing, that even a 6-week trip to, say, for example, tropics changes a people's gut flora dramatically. Somebody from, say, Denmark or Sweden travels to Indonesia, or Malaysia, would see that their gut flora would change, and it takes several months for it to find the homeostasis or balance. So the damage to the gut bacteria community. So we are learning that body is a lot more complicated, and you carry about 5 kinds of bugs, and some of the one of the well-known British researcher named Ed Yong has written a book about the microbes within us, type of thing. So, which is a very popular book, published in, I think, 2016. So the damage to the gut microbiome and the permeable membrane that we have in intestine has a huge effect on our internal milieu, as it is called, affecting obesity, energy imbalance, immunity, metabolism, hormonal modulation. So we can talk at length about the microbial environment, and that's a whole new science that we are learning. Okay, now moving on to my colleague alluded to the dialysis in a local scene, but the original dialysis went back to the early 40s during the Second World War. Enterprising physician named Dr. Willem Kolff created the first dialysis machine in the Netherlands, with using a really jerry-rigged equipment such as sausage casing, tin cans, washing machine. And again, so then he was also involved, and then he later on moved to the United States and donated his equipment, and then moved on to other bigger things, to working on artificial heart and this thing. So that was the start of the dialysis in the early 50s, and it was gradually adopted at Mayo Clinic and other centers, and became widely accepted as this thing. And then during the Bush administration, the government decided to offer that it was covered for any renal failure patient. Now, again, while that has been a great boon for people with hypertensive and diabetic kidney damage, but at the same time, the nephrology community has extended the envelope. That I had colleagues who were nephrologists who were shaking their head as to say, well, in people who have very poor quality of life, they're 92 years old, and still the family would insist on putting them through dialysis. And again, that puts a severe metabolic stress, that the survival after hemodialysis was relatively very, very poor due to other comorbidities that develop, including heart disease and infections, of course, and low hemoglobin. So, right, and again, the changes in your hormonal status, i.e., parathyroid and thyroid. So it's not, without its share of complication. On the other side, as you may remember, in the 40s, the epidemic of poliomyelitis led to the first rise of iron lung that was discovered in Denmark, and then led to the whole ICU movement that started not just in Europe, but spread across the United States and UK. And this was again very quickly adopted by the cardiology community, and the monitoring of the heart and the first cardiac intensive care units were established in Ireland. So it's been progressive care increase in more hospitalized and more sophisticated care that took place. So again, and then again, obviously with the wars, we got involved into trauma and post-surgical care improved dramatically. And as my colleague alluded to, there was the total intravenous feeding called, the technical word is called hyperalimentation. So further more attention to nutrition. So all the systems were coming into effect. So just from the early diagnosis at bedside or just in hospital, we improved the intensity of illnesses, increased dramatically. And that led to the further increase in our lifespan from 70 onwards, that people did not die of organ failure that we used to see. Okay, so this is now again for dialysis. You have to drain the blood out from one end and put back in after cleaning all the toxins, such as blood urea and stuff. So, and there are varieties of technique of creating fistula between the red channel and the blue channel. Okay, so and this is still. And a lot of the surgeons are using different type of more risky vascular access type of thing. Okay, so this is, again, so it's become sort of a money-making business for a lot of surgeons. So they've learned the technique, a lot of nephrologists, and that's all they do. The actual dialysis, which is not that lucrative, since the government has reduced the payment, it's been farmed out to various commercial companies. And one commercial company called Davita, which controls about 37% of the market type thing. And again, I alluded to earlier that, low hemoglobin was a factor. So red blood cell stimulating chemicals called apogen was developed. And sometimes as to at what level people should receive the drug has been a point of contention. And some of these companies were accused of abusing this drug and generating a lot of income. At the same time, there is some private enterprises, the one company called Monogram Health, which was started in Tennessee, has encouraged the more genteel way of dialysis, where it is done through peritoneum, which is the abdominal cavity, where all the dialysis is infused over several hours and is taken out again. So this requires some involvement on the part of the patient, but with supportive ancillary staff, they were able to offer so-called peritoneal dialysis in about 30% of the cases versus 10% nationwide. Because in the United States, patients generally turn down peritoneal dialysis, which requires a effort on the part of the patient type of thing. So it's, so it can be done, with good support of a teamwork type of thing. And these particular companies' statistics are quite enlightening. They're able to reduce readmission rates and other stuff. So, but again, that's a big expense that the government has undertaken by offering dialysis. And again, and at any age has become a big ethical dilemma as to at what age and what quality of life, because obviously being stuck to a machine for 3 hours, 4 to 5 hours, 2 or 3 times a week is not exactly a good quality of life. Okay, and so the use and overuse, underuse, and misuse of dialysis, especially even like patients with dementia. So people are going around at nursing homes and searching for cases type of thing. And Denver-based Davita settled the case for overuse, as I alluded to earlier type of thing. So they were penalized. So more than 100,000 Americans start dialysis, and the survival rate is, not exactly spectacular, and we are not doing as well as some of the other nations are doing. Okay, so enough about dialysis, and we'll talk more about the organ transplant, which is again another bottleneck due to lack of available organs. So we'll dwell into it in just a few more slides. Okay. And again, the biggest advance that we have to mention that occurred in biology and revolutionized was in 1953 when Crick and Watson came up with determining the structure of the double helix structure, and with a nod to Rosalind Franklin, who had the original X-ray crystallography picture, but she had moved on to different things. So that has always been a big bone of contention that she did not get enough credit. And unfortunately, she passed away due to ovarian cancer. So she was deprived of the Nobel category, but she's memorialized in various schools and places that have been, and has been named after her. And this is a famous place, the pub where Watson and Crick said, "We have discovered the secret of life," a rather modest statement. And that started the whole era of genetics, that I've done talks on that, but just to go over, starting from Gregory Mendel's peas to DNA structure to various enzymes, and the whole march took over 50 years to the culmination in 2000 when Bill Clinton and Tony Blair, announced the human genome structure. But that was not a complete genome structure, and it's only very recently this year that all the entire 23 chromosomes have been determined, and the promises were great that human genome will actually cure all the chronic diseases but again, as it happens in biological system, the system is a lot more complicated. And while we have made tremendous progress in curing and diagnosing single gen diseases, and especially at newborn and in the early years of life, but the other chronic illnesses are so-called polygenic, which involves multiple genes. As many as 80 genes may be responsible for diabetes or schizophrenia. So that is like looking for a needle in the haystack. So it's become a challenge, and how it will all pan out, that remains to be seen, type of thing. Okay. And so we've come a long way, type of thing. And then again, the DNA is, like, as you can see, it's that I don't think they have any walls, type of thing. So this is DNA. Some of you may not be familiar. This is CF, is called cell-free DNA, which is circulating in your body. This occurs even after pregnancy, that the fetal cells can be circulating in mom's body even during pregnancy, and that can be used to diagnose prenatal diagnosis. So that's a huge advance that has taken place. Instead of having to stick a needle inside the pregnant uterus, cell-free DNA from the fetus can be analyzed for various chromosomal abnormalities. RNA is the messenger RNA that we are all familiar with the COVID vaccine. PCR is, if you have seen any crime shows, that was a dramatic revolution in forensic medicine and in doing analysis of genome. That is the technology that revolutionized the molecular medicine, and varieties of biotechnology rise has changed dramatically. And CRISPR was the new way of editing your human genome that got the Nobel Prize to the two ladies, Jennifer Doudna and Emmanuelle Carpentier. And then again, we have extended not just DNA analysis of the 23 chromosomes and all the lectures of A, C, G, and T, letters of the 3 billion letters of your genetic code, but also the determining the structure of the RNA and the epigenome and the microbiome and analysis of the protein that are there, called proteomics. So this is a whole slew of words, and there's a whole new discipline such as bioinformatics have come into existence and has revolutionized medicine. So we are really actually, quote unquote, if you're a believer, you can say we are reading the might of God, or exploring the nature at the micron level, type thing, because some of the DNA is extremely small and about 5 meters of DNA is trapped inside a tiny cell. In each and every cell carries your DNA, which you inherited from your mom and dad. Okay, so enough quick summary about that. And now, some of you may be aware of this Theranos scandal. This was a 20-year-old Stanford dropout who had claimed to have a company where simple drop of blood will analyze hundreds of biochemical abnormalities, and had managed to charm hundreds of investors and raised several $100 million and started a company called Theranos Therapeutics. But it just turned out to be there was a big house of trick with mirrors, and their company never really had successful technique. And after a dramatic rise in the value of the stock, it just folded, and people lost their investment in both the Elizabeth Holmes and her gentleman friend, was waiting trial and to be sentenced for fraud. And they were, with the name of secrecy, they really pulled wool over the eyes of varieties of big corporations, including various pharmaceuticals and various savvy investors. So that was one of the scandals in molecular biology. On the other hand, there is some legitimate research that Stanford researchers are analyzing thousands of protein, fat, metabolism from single drop of blood. So it may be coming into fruition, with further advances with more legitimate winners. So we've come a long way from looking at the chromosomes under a simple microscope at bedside to diagnose chromosomal abnormality. This was one of the earliest chromosomal abnormalities that was diagnosed, so-called Down syndrome. The old word that is no longer used was called Mongolism due to the appearance. So that's the chromosomal abnormalities of trisomy 21. The 21 chromosome has extra pair due to a lack of separation. So, and sometimes, a lot of these cells, are fragmented. When the cells die, they leave fragments in the blood, and that has been a big boon in diagnosing various cancers, such as melanoma and thyroid cancer, various leukemias, colon cancer, lung cancer. So that's been a big advance, in terms of so-called liquid biopsy that we talked about at some time. But at the same time, as it happens in science, we take 2 steps forward and 1 step backward. And with the over-enthusiastic treatment for gene therapy, a young man, J.C. Gelsinger, died at Pittsburgh Medical Center in the early in the 90s, because even though the gene therapy was given with a viral vector, he had a strong immune response, and he died of multiple organ failures. And the accusation and the proof was that some of the researchers did not follow the protocol as reliably as they should, and that created a huge setback to gene therapy for several decades. Again, it was tried with the CRISPR technology by a Chinese scientist, and again, that was called the so-called germline editing that he undertook, and that was initially appraised by the early research communities, but later on was severely criticized as sort of crossing the red line, and even the Chinese government, which initially thought that he was a hero for doing pioneering work and a big advance for Chinese science, actually criticized him and censored him, and even gave him a small to moderate amount of prison sentence. So that is, the germline editing is still considered a no-no, because we don't know as to how it would be forever, so to speak. And he did editing of human genome by trying to remove a gene that makes you less susceptible to HIV. And his claim was that the HIV, there's a huge stigma in Chinese society, and so he was giving them a good head start from birth. Okay. Now again, gene therapy has made some good forays, that even chronic illnesses such as sickle cell, if you get 2 copies of the abnormal gene, okay, but only 1 letter is abnormal, gene therapy has been successful And it has a potential to cure these illnesses such as sickle cell disease, thalassemia, etc. But again, the cost is, nothing to sneeze at. It's still how it will pan off for average man or woman in the street. That remains to be seen. Okay, but there is some dramatic change that's been taking place, and we did a whole class on gene editing type of thing, and so that is the future is really bright. And based on genomic analysis, varieties of drugs are synthesized, which are so-called biological agent, and even some of the chronic illnesses, which were hard to tackle with, and the lifespan was relatively small, are being cured, such as the common illness called cystic fibrosis, which is the gene is quite common in North European population, but not everybody gets the disease. So, and if two people with the same recessive abnormalities get married, then the child has a 50% chance of coming down with cystic fibrosis, which is where you cannot handle secretions in your lung, and you get repeated infection, and that prohibits the growth of the individual. And the usual lifespan was about 20 years, and it requires chest compression therapy and very extensive treatment to prevent infections. And with that, now there is a cocktail of 3 biological drugs that is available, which are called biological agents for cystic fibrosis for people who have mutation. But the cost of therapy is, almost, in 5 digits. And the cost for some drug, if I recall correctly, was $360,000 per year. And again, and the company, it is a small company called Veritas that is marketing it, has not even bothered to market it in developing countries such as Brazil or India. But so it's an expensive core. And the New York Times had an article, they created a drug for this particular group, or what about the millions of other patients, as to how many of them would be. So this is like becoming, a class distinction, and this portrays the Hollywood was ahead of real life. There was a movie in '97 called Gattaca, which has to do with the genetic letters, so the so-called survival of the rich. And we saw that play out very easily during the mRNA, that Canadians had 3 times the stockpile that they had purchased, while the other countries were still waiting in line for their vaccination. And especially the vaccination rate in sub-Saharan Africa was dismal. Okay, getting more to the more positive side, when polio was a big scare in the late 40s and 50s, and the Sabin and Salk race varieties of books have been written for the so-called attenuated or killed vaccine. And the 2 heroes, Dr. Sabin and Salk, were working in friendly competition, and where finally the largest trial was carried out, involving 20,000 physicians, public health officers, and school personnel and volunteers. So almost close to 2 million children took part in the trial, and the result was published in 1955, and Dr. Salk was hailed as a miracle worker. And this was like the victory of human ingenuity over paralyzing and debilitating disease, because people were left with iron lungs for almost 18 to 20 months. And then later on, oral vaccine was marketed by Dr. Sabin, and that was undertaken by WHO. And finally, one can safely said that polio has been eliminated from almost the entire world, except for a few outliers, such as Pakistan. And during the ISIS, that the CIA used one of the Pakistani physicians to trace Osama bin Laden, and that almost put a real huge damper on the vaccine treatment in that part of the world. Okay, but again, there were some step backs type of thing, that the one batch of vaccine was contaminated, causing some deaths and disabilities. So again, but this was, one can say, and they did not obtain patent on this listing. So it's a, and again, we're all very well aware of the vaccine data for, of how many people were in favor of the COVID vaccine, and the anti-vaccine movement, based on Spiros came from a British physician who claimed that vaccine was likely to be associated with autism, so that prevented a huge damper on measles and mumps vaccination. and that fear and false information carried on into COVID, and we went through the vaccination rates have dropped, leading to a resurgence of diseases which we had suppressed, such as measles, even in developing countries. Okay, and measles is tremendously contagious, even more so than COVID. Okay, so in childhood, measles is nothing to sneeze at by any means. Okay, so but I think that's we can talk for hours about that. But so that's one of the tragedies, and again, we did not have enough information on COVID, type of thing, and that's a varieties of trials have been undertaken, and the virus has been around for a long time, and we learned our lesson in 2012 with first SARS, and which started in Hong Kong and spread to Toronto, and with quick isolation and public health work, that did not become a problem, followed by MERS that occurred in Middle East, and that was a lot more contagious, and only to be followed by COVID, which is SARS-CoV-2, and finally, by this time the mRNA vaccine was funded with the great initiative, and we've seen, with the mutations that take place. So all of us are very well aware. So I should not elaborate on it. So, and a lot of things was funded by the U.S. government, and for whatever reasons, the government did not insist on intellectual property, and so the initial price was, okay, under $25, but then later on, the prices have gone up for other countries, type of thing. So, and actually the cost is relatively small, okay, for manufacturing. The Pfizer and BioNTech, made big deals, type of thing, with the government, and they initially promised that they will give some breaks to smaller countries, but how that will be provided. So that again, so this was, and they were not willing to share the technology with other companies, I think, and the program was primarily restricted to rich countries. And, they have made out quite well, thank you, type of thing with the vaccines. And so financially, that has been a bonanza for the two companies. Okay. And then again, the kidney transplant was started back in the early 50s by pioneering physician named Dr. Joseph Murray. Now, at that time, the rejection was a big problem, and they went through varieties of trials and tribulations for 10 dark years due to deaths and rejection that took place. And until in the early 70s, azathioprine, the anti-rejection therapy, became available, and that showed that data gradually started improving. At the same time, on other front, for the chronic leukemia, people in Washington area were working on a bone marrow transplant, and Dr. Thomas. So again, it was an incremental progress that took place. And these two physicians, Dr. Murray, who worked on kidney transplant, and Dr. Thomas worked on bone marrow transplant, were Nobel Prize winners. And a lot of initially was that the work was as a result of damage that occurred due to atomic blast and a higher incidence of leukemia. And some of the organ transplant work was carried out by Dr. Thomas Starzl, who we'll talk about in a little while. Okay. So we were talking about the transplant that was, took several efforts from various determined physicians, which started the role for kidney as well as bone marrow transplant. Okay, moving on to, I think we alluded to the thalidomide disaster, which took place in Europe primarily for a drug that was marketed for morning sickness and caused severe genetic mutations and abnormalities in newborn babies, where they were born without harm. And due to the skepticism and diligence that there were not adequate trials done, a physician named Dr. Frances Kelsey, and she held out on that the drug was not approved in the United States. So, and she was recognized by John F. Kennedy for saving so many lives. And there was not adequate testing that was done, and South America and Europe paid a heavy price for it. Moving on to the a dramatic announcement of heart transplant that was groundbreaking enough from South Africa by a surgeon who was sort of a little bit of a prestige hunter, so to speak. And even though he did his training in the United States, he proceeded with the trials without giving credit to the people from whom he had learned the technology in the United States. And a guy named Dr. Christian Barnard, who did the first heart transplant, and his patient lived for only a few days and succumbed to rejection and infections. And that was the start of the heart surgery. And subsequently, the more challenging work was done by Dr. Thomas Starzl, and on the west in Colorado, and he later on moved to Pittsburgh, and Pittsburgh became the major Mecca center for transplant surgery. And he did some pioneering work for liver transplant and hundreds of kidney transplant. And with incremental improvement in rejection therapy, with varieties of drugs such as azathioprine, which are the immune suppressant agent, as well as cyclosporine, and one of the drugs which was discovered in the soil of Easter Island called rapamycin, and that the fungus that helped work with the rejection therapy. And then again, he devised various mechanisms as to how that allograft transplant, which is from a donor, can be accepted, because some of the cells of the leukocytes or white blood cells, which are from the donor, can play a role in immune suppression in the host. So that was a dramatic work, and he lived to be age 90, and he continued to research, and is a giant in the field of transplant. And here's a nice YouTube video on him about the giants in medicine, for those of you who are interested. And continue on the West Coast, Dr. Shumway was another pioneer in heart transplant and on the West Coast. And so these two people actually were big this thing. And now, obviously, we are all aware of the long waits for transplant. That's why a lot of people are stuck on kidney dialysis, and they're while waiting for organs. And for liver, it's relatively short, but again, the liver transplant is one of the most complicated organ transplant. For heart transplant, it's relatively short, but again, the donor may be in the wrong start. So varieties of people are devising a way to keep after harvesting the heart from a donor organ, to keep it alive and functioning, so it will not start degenerate and be rejected. There are varieties of technology that are being developed to preserve the organ preservation, and that's a race against time, so to speak. And again, when it comes to transplant, there are a lot of inequalities in terms of organ transplant across the United States. And there is a consortium that is formed for regional transplant organ availability. And again, transporting organs across the United States is difficult, because the time is of essence. And sometimes the referral, acceptance, those are varieties of hoops that people have to jump through. And sometimes, some of the patients who would be good candidate are not even considered. So there is a disproportionate rejection rate. And to overcome this type of waiting, some of the people who are working with CRISPR technology to modify pig organs so that they can be used for human transplant. And there are various viruses that are endemic in the pigs. So based on CRISPR analysis, the pioneering group of Dr. George Church was a pioneer in CRISPR technology at Harvard, Mass General area, and they're working on it, and they're coming very close to successful testing. And most recently, a kidney transplant was done from pig to kidneys in New York. Okay, and so that is the future that is coming for in maybe in next few years, it may become a very viable option. And other countries are actually, in the United States, you cannot get paid for donation, but countries such as Iran are actually instituting a system of payment for indigenous people who actually want to donate kidneys. And there are a lot of scandals that are taking place in that people have medical tourism, where unsuspecting people, some of the unscrupulous physicians are actually stealing kidneys when people come in for relatively minor operations. So that's really some shoddy practices that are going on, all not in the United States, but at least around the world, that the gullible people are being taken advantage of. Okay, on the other hand, on the in the gynecology field, a big paradigm shift that occurred with the discovery of estrogen and progesterone combination, the drugs which were synthesized, from initially from the plant, Mexican yew plant, and the synthesized progesterone from was devised, and the varieties of Puerto Rican physicians and with the foundation of Planned Parenthood and Margaret Sanger and very rich heirs, McCormick, they did the pioneering work, and that was the start of the oral contraceptive therapy. And it's an interesting story behind it, because the research was done in Puerto Rico, and this was done in the poor neighborhoods where, being heavily Catholic, women wanted some useful way of birth control, and so they put up with a lot of side effects. And again, birth control pills have not been without their problems in the issue that with the high estrogens, women had a lot of symptoms, and again, a lot of times these were ignored, and then finally the correct dosage has been devised, and that just changed women's lib movement dramatically, type of thing. So, and again, people have had interesting either rejuvenation for men and contraception. So varieties of measures have been tried, including, and there have been some scandals that some of the devices that were implanted in women for birth control, that perforated, had caused pains, and some of the devices were recalled. Okay, so it's a very checkered history of oral contraception, and again, the paradigm has shifted with the reversal of Roe versus Wade, that the so-called morning after pill is being questioned as to whether that is quote unquote ethical or not. So this is, and that just changed the work structure, workforce of all across the Western world, because women, for the first time, they were able to introduce and control their reproductive, planning. Okay, and at the same time, with the rise of new generation of antibiotic in the 50s, the advertisement and commercially marketing and the big pharma came into existence, and this was pioneered by Dr. Sackler, and you may be familiar with the Sackler Museum in Washington, D.C. And he was a psychiatrist by training, and he very cleverly marketed tetracycline and made a big seller, and with sending out something called medical letters to varieties of physicians, and was a savvy, was a combination of Madison Avenue and Big Pharma. That was the first union that took place. And subsequently, he went on to buy a small pharmaceutical firm, which marketed pain relief drug called morphine. And with the collaboration, the heavy marketing that was done for long-acting morphine called MS-Contin, and that created the big opium epidemic that we went through in the late 80s and 90s. And that's a big story, which was well summarized in the book by Patrick Brad Kiffey called Empire of Pain, and as to how slick and clever marketing that was done with some gullible physicians, some unscrupulous physicians, and usually probably in the Deep South, how physicians were targeted and heavily marketed by the drug salesmen who received huge bonuses. And so it's a very sad story as to it caused more number of deaths than were with a lot of other causes. And this was again really tied in with the economy, which was going down with the factory closures, especially in the Rust Belt, so to speak. And again, physicians were not aware that the drug was pain relieving drugs or opioids were marketed as they were not addicting. And usually people handed out these tablets like candy, so to speak. And there was a big and the prescription drugs were farmed out to street, and that again perpetuated the epidemic. And now again, and then with the strong policy of anti-drug, we put a lot of people in jail, and again without offering initial therapy for mental health. And now finally, within last few years, the treatment approach has changed, and from imitating some of the European and Canadian approach, even New York City is initiating something called a harm reduction initiative, so that they're saying that they're offering people access with clean needles, and so that they don't end up with overdose and sudden death, and again infections such as HIV and hepatitis. So they're doing, even providing safe injection site, with the opposition from quote unquote ethical people, as to say people were worried that we are promoting a drug habit, But again, so we have not won the war against drugs, in spite of huge effort. So that is a new initiative that is being tried, that along with that, mental health is being funded. This was offered by Richard Nixon in the 70s, but after his departure, all the initiative was shelved by the Reagan administration. And again, we talk about medicine advances. These were the big dramatic advances that took place, the life-changing therapy that were done, such as intensive care unit, ventilators, the imaging technology, which are diagnostic, and then the surgical treatment, which was joint replacement, eye lens replacement after cataract surgery, cochlear implants. So these were varieties of dramatic, 3 forms of new technology became available. And you can see it the same way on the other side. Dialysis and pacemaker are right up there, and cardiac catheterization and endoscopy. So these are all advances that came to in day-to-day use back in the late 40s, early 50s, and really became norms by 1980s. And that has changed the average lifespan from 70s to as much as 80s, and now into the 90s. Okay, so these are the good progress this thing, and we've seen that every stage we've had some problems that either due to overuse, underuse, and lack of availability. And again, at the same time, gynecological front, people in UK had done, intravenous fertilization. First it was done in vitro, means that's outside, and then again with laparoscopy, harvesting the eggs, doing in vitro fertilization with other partners' sperm. And after several false starts, and with some meticulous effort, intravenous IV fertilization, in vitro fertilization was successfully carried out with the successful delivery in the 1970s. And again, this was considered as heresy against nature, but now it has become norm. And Louis Brown is now more than 40 to 50 years old, and millions of babies have been born with in vitro fertilization type of thing. So, and again, the clinics have popped up all over the country and world, and depending upon the experience and the skills, the success rate varies anywhere. And obviously, the success rate is far more than when women under 35, as opposed to women over 40 or 45 type thing. So again, and that is a very expensive procedure, and there are a lot of fly-by-night clinics that have opened up at the same time. So one has to be very careful as to where you go and how expensive it is, and it causes a lot of emotional and financial drain on expectant couples. Okay, and a lot of them was self-pay was done, which led to reduced cost. But at the same time, there is a risk of multiple births that has to be taken into account. And so sometimes we are pushing the technology, and that backfires, that people have it not just twins, but triplets and even quadruplets type of thing. Okay, and so this is a very common procedure that is done. And prior to that, some of the easier measures that are available is called intrauterine insemination, as tried. and then it's called artificial insemination, and then in vitro fertilization is the next step type of thing. And then the embryo is edited for genetic abnormalities and and now even the working women are encouraged to preserve their eggs because the fertility decreases after a certain age. Okay, so that's enough about that. And these are some of the ethical issues we talked about. I mean, this is almost boggles your mind that a woman in India gave birth at age 74 with artificial insemination, and that is just showing us to what exactly we are doing. So some of the ethical consideration, and even single women and same-sex couple can have a biological identical child. And then again, varieties of questions have raised as to when couples get divorced, who owns the stored gametes and embryos. And again, so genetic testing is the big norm nowadays. And again, the surrogacy has been around, and a lot of the developing countries offered so-called womb for hire. And so the technology has become rapidly commercialized. Everything, and these are some of the headlines that you can interpret for whatever it is worth, type of thing. And there are some unscrupulous physicians who use their own sperm for fertilizations, and people have found out after several years. And again, surrogacy is against politicized, because India, which used to offer surrogacy with a payment basis, that has banned it now. So again, so there are varieties of ethical concerns that have come up with reproductive advances in reproductive technology. Okay. Again, moving on to psychiatry, we said about, we moved away from the Freudian model, and in the early 50s, then tranquilizers and sedatives and hypnotic were marketed, because with the Madison Avenue and the stress that was apparent. And the earliest drug that was marketed was called Miltown, which was heavily marketed in so-called Miltown craze, became widespread in the 50s, later on to be followed by, again, the more minor tranquilizers called Valium. And again, the campaign for Valium was heavily marketed by none other than Dr. Sackler, and he made that almost $1 billion drug, for Roche Pharmaceuticals. And then initially it was Librium, and then later on was Valium, which was very similar, but again, the marketing genius of Dr. Sackler and Madison Avenue, promoted that all with the stress, with the rise of prosperity and more affluence, it became almost it was widely used like candy. And again, it was a habit-forming potential was minimized. At the same time, some of the other stronger tranquilizers, such as Thorazine, was marketed for calming effect for the mental illnesses such as schizophrenia and manic depressive. Lithium, which was an old inorganic metal, was marketed for management of manic depressive psychosis, and that led to closure of a lot of the psychiatric institution, which was well dramatized in the movie One Flew Over Cuckoo's Nest, and the incidence of electroconvulsive therapy went down. And later on, this was followed by treatment of depression with selective serotonin inhibitors. So, and again, that some of the theory behind it is being questioned as to how effective they are, and how the body is a lot more complicated. There were indigenous flora maybe playing a much bigger role in affecting our brain. So there is so-called gut-brain axis maybe playing a bigger role than we realize. So the solution and the receptor, the biochemical pathway interaction may be a lot more complicated than we have realized. So psychiatry is still trying to find its roots as to how to correlate with the neurophysiology, and the advances are still very incremental in the future. And the new technology that is being offered for treatment of depression is called transcranial magnetic stimulation, where there is electricity in the brain type of thing, and electricity and magnetism are two sides of the coin. So based on that, treatment of depression is being recommended for severe depression. Okay, and so this was some of the Dr. Sackler's this thing that that when they marketed OxyContin, they went out with the idea of training as many as 12,000 doctors, and their promotion lasted from. And they were very well aware that these drugs had potential for habit forming, but they continued to push the drug. They gave out some payments, and they were even fined, but in spite of that, they continued to market the drug, and they kept. And at the same time, the scientific community was also doing it because with the veterans, they said pain is the fifth vital sign, so to speak, and that gave the primary care physicians a reason to treat and overtreat without realizing the addiction potential of opioid drugs. So OxyContin epidemic took thousands of lives, and now it is replaced by a street drug called fentanyl, which is even more lethal, and it just keeps coming across the border. So the drug epidemic is still taking its own toll, except for the prescription drug has been substituted by the street drugs, which is even cheaper. Okay, and at the same time, when people who are opening up the pill and injecting it, they had HIV infection, sudden death was a big thing. So the American Academy of Pain Medicine had again indirectly a role to play. Okay, and this is again some of the data that you can see, the synthetic opioid, the graph, the blue indicates synthetic opioid use, other than methadone, varieties of other drugs. Prescription opioid drugs have actually, after our learning experience has gone down, this is the orange sign. The heroin is still very much there. It hasn't totally disappeared, the yellow line. And the benzodiazepines, the tranquilizers that we talked about, antidepressants are way at the bottom. So this is the drug involvement amongst all ages over the span of 20 plus years. You can see that the numbers with synthetic opioids have gone up exponentially, and as many as 90,000 drug overdose that took place in 2020. And so the numbers are staggering, and the synthetic opioids have jumped and continues to be a big problem. And one can say that these are the so-called deaths of despair, which are the economic hardship, lack of job and resources have played a huge role. And the street drugs are being flooded from across the border. And again, the mental illnesses, we are fairly lagging in personnel and availability. And so this is the crisis that we see. And then a lot of the hospitals have actually closed down their psychiatric units because simply they're not profit making. There is a lot more money to be made with joint replacement rather than offering competent psychiatric care. And physicians are reluctant to train into as well. So there is a huge shortage there. And surprisingly, the Veterans Hospital does a better job than the other institutions. And so the number of mental hospitals have gone down. At the same time, the prison population has climbed. And so this epidemic has been still, we haven't found a solution for that. And that has indirectly plays in with the gun violence as well. Okay. And so the number of hospitals has fallen, dramatically from the Reagan administration onwards. And the variety, and some of the legislation that was proposed by Jimmy Carter was repealed by Reagan. And again, the responsibility was pushed back to the states. And again, in the homeless crisis, tries indirectly. And on the West Coast, 55% of homelessness was related to emotional or psychiatric illnesses. So these are the big societal ills that we have not solved. On the positive side, the big advance that took place in the 60s was, the advance of cardiopulmonary resuscitation, and with the gradual widespread campaign by the American Heart Association and varieties of organizations such as Red Cross, a lot of people have learned, and the training of the basic life support along with widespread advanced cardiac life support become available. So this is the whole history of, and so our success rate, and again, in major crowded cities, the ambulance access is still very poor. And some of the West Coast cities have done a better job in training general population for cardiopulmonary resuscitation. And it's become, the routine that, and people are even able to buy automatic defibrillator at home. And in the varieties of public gathering places now, the defibrillator are available, and they're relatively simple to use. that they're very well made, that even a layperson can administer a shock without any harm. So the training and other stuff has been the big plus in saving lives, especially with sudden death. And you see that sometimes on football fields as well, type of thing. And the recent example of the football player who had the injury to the chest and his life was saved with cardiopulmonary resuscitation. Okay, and okay, so but at the same time, there are other things that can and it can also create a problem that sometimes we can resuscitate the heart, but at the same time there is enough brain damage creating a so-called a brain dead patient, and they can live for a long time. In my own practice, as an example, that a young lady who had a very unusual cardiac defect suffered an outside the hospital cardiac arrest and was successfully, her heart was restarted, but her brain was had sustained severe anoxic damage, and she lived on respirator for almost 8 months and finally succumbed to some infection. So it just and sometimes when we are good intention, when we do CPR, we're still unable to predict how the brain is going to respond. Okay, so that's so that we haven't come to and there are varieties of new techniques such as cooling down the body are being used. Okay, and on the preventive aspect, obviously the big change that occurred in cardiac therapy was discovery of statin or cholesterol lowering drugs, because when we finally discovered receptors in the liver, which give the Nobel Prize to the discoverers in 1987, and Merck Pharmaceuticals and other Pfizer that followed, I think, devised the statin drugs which work on the LDL receptors type of thing, and that made a dramatic shift. And varieties of large multicentral trials that were done of thousands of patients at huge expense, and by lowering cholesterol and inflammation with more potent statin drugs, we can just see that the trial had to be prematurely stopped because the advantage was so overwhelmingly in favor of statins. So the inflammation role in cardiac disease process, i.e. at hardening of arteries, became very apparent. So the endpoints were reached very quickly for these trials. So that changed to the guidelines, and now again in the American Heart Association pushed Know Your Cholesterol campaign type of thing. But again, now we are putting it in proper perspective as assessing the people as to who should be treated based on what is good for the so-called bang for the buck theory, as to your risk ratio is calculated based on risk factors such as family history, obesity, coexisting disease such as diabetes. And so this is, and how many numbers we should treat as to what is cost-effective way of treatment, as the efficiency versus effectiveness comes into picture. So the statin story is finally being put in proper light. Okay. And so statins are recommended for people with extremely high levels of density propionate with other risk factors. But so it can be, and so you have to treat a large number of people, type of thing as to who benefits from taking statins to when. So some of the authorities are questioning as to whether treating people just numbers doesn't make any sense, because you have to treat, and then they have some side effects in terms of, muscle damage and some liver toxicities in a number of people. So again, even though they are very effective drugs, just treating the numbers alone is being questioned, and rightly so. So that treatment decision should be based on individualized rather than treating wide population as general. And so there are varieties of measures that are being evaluated. At the same time, in the 80s, we dealt with another epidemic. We may have forgotten or gone the backside with COVID, and this was the HIV that exploded in 1981. Initially, the disease was considered to be confined to Haitians and amongst gay people, and a lot of public fear that took place, including a young schoolboy who had contracted HIV, which was called acquired immune deficiency syndrome in 1980 from he had hemophilia, which requires multiple blood transfusion, and faced discrimination from his school and was not allowed to attend school. And this was taken up as a cause for gay discrimination in the gay community, including well-known actor musician Elton John, and he died at age 20, and this was in southern northern Indiana. So this is the plaque memorizing him. And AIDS came into effect. This was the earlier report that came out in 1981 in the morbidity and mortality report, which are issued by CDC. And this was an unusual type of pneumonia that was reported that occurs because there is no immunity. And the general public became available when the movie star Rock Hudson died due to HIV. Okay. And again, the initial years were very rocky, and thousands of people were dying of HIV, especially in the gay community. And there was a lot of patient-related appeals for instance, in community. And the Reagan administration initially was very lukewarm in making any efforts, because of the built-in prejudice in the society. And it was considered that this was a disease of the gays. And then when celebrities started dying, then government put in some more effort. And Dr. Fauci was the initial investigation of the HIV, and he's very much around, 30 years later, and on the forefronts of COVID. And so there was a lot of public panic that went on. And again, a lot of patient activation took place, that people started going to Mexico to get the first antiviral therapy called AZT. And that was well portrayed in the movie Dallas Buyers Club. Okay. And this was finally, the antiretroviral therapy came around in the 2000s. And finally now it's, we're able to manage or live with HIV disease. And so it took varieties of combination because the initial drug, which was marketed AZT, the virus was smarter than humans and developed resistance. But now with varieties of drugs which HIV can be managed. And the George Bush, the second administration, took a very heroic act and made drugs available to Africa. And it has saved thousands of lives in sub-Saharan Africa from HIV, because in Kenya and South Africa, the disease was still very rampant. So they made them available at very low cost type thing. And the initial cost was substantial, obviously. And the Ugandan president had a huge denial type of thing. And the infection has been around for a long time and may have jumped from monkeys in Central Africa to humans. And so this is, it's a very interesting story about how HIV was finally exploded and is now we're able to. And the one person who was on the forefront for HIV activists and brought the public's and government's attention with direct action, public health activism, with the organization called ACT UP in New York City. And they were, they played a huge role in getting the ball started for a therapy. And now there are varieties of tests that are available for HIV screening, and even the so-called morning after therapy, after exposure to HIV, is now available. So the disease is more manageable type of thing. And with the patient activation, the government did put in a strong effort. Now, on the other front, big advances that are taking place was stem cells. That was started in the 70s in Wisconsin by Dr. Thompson and various other researchers. And initially, the embryonic stem cells were used because the stem cells have the potential. It's like any kid, you can go up to be anything that you want to be. So the embryonic stem cells are multipotent, and they have the chance to develop into any other organs that can develop. But after a few days, they change. And so the cord blood, and that came into contrast with the anti-abortion crowd. And that was, again, become a very ethical football type of thing. And fortunately, a Japanese researcher, Dr. Yamanaka, did some very clever molecular biology research and developed certain transcription factors, which are varieties of protein, to turn even an ordinary skin cell into a stem cell. So that can be used for, otherwise there are only two sources for stem cells, i.e. Embryo from cord blood at the time of labor and delivery, or bone marrow. And it's very difficult to harvest cells from bone marrow, and requires a very complex, sophisticated technology type of thing. So that is becoming, and again, as it happens with new technology, that is more hype and then hope. And instead of trying to research, there are a lot of fly-by-night clinics that popped up, and especially in Florida, and people started going to South America, to the Bahamas for treatment. A lot of people were charging thousands of dollars for gullible patients for joint pains, and for cardiac disease, and for cancers type of thing. So again, a lot of the trials were sham trials and did not pan out. People were injecting cells which did not survive, and so there's a lot of hucksterism that was carried out in the stem cell thing. There is legitimate research, which is done with double-blind controlled studies in reputable institutions. But again, so the genie has gone out of the bottle, so to speak, and obviously, and so Dr. Yamanaka's work and Dr. Thompson's work, so there are a lot of very respectable people have continued to work on the forefront, and that still remains the future for regenerative medicine. Okay. And there are some benefits for orthopedic procedures, and the biggest plus has been for bone marrow transplant, that for leukemias and other things, that's a bone marrow transplant has been the big in vitro played role. So there are some dramatic advances that have taken place, along with a lot of for-profit. Now this is a nice example here, so that the stem cells and blood cells, because there is something called the biodegradable scaffold that was used, and along with that, patient's own blood bone marrow co-cultured. And so this way, because otherwise, say if you put in a plastic tube inside a newborn or a child, that does not grow with the child. So this way, it can grow with the child. You can just see this is a scaffolding of cellulosic or plastic material that is, it is biodegradable, and on which patient's own cells are planted, and then organ is developed with stem cells, and you can see how the organ actually grows with the side. It just replaces the natural tissue, and this work has been done, for a child that was born with a birth defect, and it's been successfully implanted. So the brave new technology is being used effectively in at a very cost and by some very clever people. So it's an example of the advances that we are dealing with in the future is still very much. And so, and again, we talked a little bit about CRISPR, which is the gene modifying technology was discovered from bacteria, which have their own defense system. And so that was the start of gene editing and gene therapy that started in the late 90s and early 2000, and finally CRISPR exploded in 2012, and so that was the event-breaking thing. It's relatively straightforward in terms of gene editing technology. And what I mean by gene therapy is that a new gene is inserted along with a viral vector, and so that that we talked about. So there are varieties of ways of modifying the human genome. So finally, we are seeing some of the biological advances. But again, the prevention and the early diagnosis of abnormality becomes a big step to be taken. And adequate counseling before conception, goes a long way, and it's a lot cheaper than doing gene editing. Okay, and this is the example of the human genome analysis that was promoted at the NIH. Francis Collins and Craig Venter, who had a commercial venture, and Bill Clinton. Okay, so there was the human genome analysis that was the a big discovery of the 2000s. Okay, and these are the breakthroughs of year 2025, which we already talked about: CRISPR, vaccines against Ebola, and yeast engineered for opioids, and the immune system. So these are some of the big advances that were reported in Science magazine. Okay, so the big success story was Victoria Gray, and who was treated with gene therapy successfully for sickle cell disease. Okay, all right, and again, as we've already talked about, 50 years of stroke, that this blood clot dissolving therapy, that the neurologist finally took a page from the cardiology book and started to dissolve blood clot, and now they can put even a little coil, the so-called stenting, to relieve the blockage inside the brain, tiny arteries, which can cause strokes, and time has become of an essence. So the strict stroke treatment has been revolutionized with the advances in clot dissolving therapy, with tissue plasminogen activity that we talked about, and various endovascular or stenting therapy. So the X-ray doctors have become very clever in terms of relieving the obstruction that is causing the damage. Okay, so there are unequivocal benefits has been well established now. And again, some of the other advances that can taken place in the recent past are laparoscopy, or doing surgery with, by making minimally invasive surgery and has taken place. And again, a lot of times, some of the physicians who have not well trained are still sticking with the oldest thing, and sometimes they are not quite honest in explaining to the patient that they're not skilled, and patients are not aware that this technology is available. But gradually it's becoming widespread with the newer generation of surgeons. And from the early days a lot of the surgeries that was done with open incision, requiring longer hospitalization, increasing infections, it's become the norm nowadays by 2020, including appendectomy. But at the same time, as mentioned, that a lot of times, more conservative approach for appendix, it should still be tried rather than doing laparoscopic surgery. And it reminds me of the stories in Green Bay where two of the family so-called on-the-job trained general practitioners used to book an appendix surgery and used to take out a lot of normal appendix. So that's still the trend in smaller areas, still continues type of thing. So, and the same way, and a lot of the hospitals are competing for patient clientele and promoting expensive robotic surgery, whether that really reduces the complication rate, that remains to be seen. So it is becoming a marketing tool for some hospitals. And but the laparoscopic surgery, even for heart and for gallbladder and for prostate, are becoming, the norm and are being widely available. And so some of these machines for robotic surgery are almost costing millions of dollars. And at the same time, there are other fancy technologies such as CyberKnife for radiotherapy and proton therapy are being promoted. So we are, doing, and now the question comes up is whether are the newer technologies necessarily superior, they're not, and that time will tell type of thing. And so, and again, so the prudent cost is the careful evaluation of various technologies is still not being done, and the financial incentive and fee-for-service role takes this thing. And again, a lot of people who've done robotic surgery says, well, it takes a lot of time to set up, and it becomes a disaster if the surgeon is not at the side of the patient, and becomes a disaster if there is a cardiac arrest. And a lot of the hospitals are using this as an advertising gimmick. Okay. And there's a big learning curve. And now, again, lastly, before we wrap up this session, you can see that these are from the prestigious Nature magazine. This is the trials that are being awaited, for example, and varieties of trials that are being awaited for Parkinson's disease, obesity, which is a long-term diet, Mediterranean diet, which is considered the go-to diet for obesity and cardiac disease nowadays. And the so-called other Atkins and others diet, have had their day in the sun. The big awaited trial was the new Alzheimer's drug, it has been approved on an earlier approval basis for Alzheimer's, but the phase 3 trials, that will tell when the larger study as to whether it makes an impact. And obviously the vaccines, are still in the play. CRISPR is still being considered so that will remain to be seen as to how effectively we can deliver it to people who really need it. and the varieties of screening-based trials, for new screening biological agents are being awaited. Okay, so these are some of the future trials that are being seen. So I think we've come up with the advances. We've turned a full circle from the early days of X-ray in 1900 to the most modern trials that are available. But the maldistribution of some of these technologies and the cost will still remain a big societal problem. So, okay, so, and so we can see that life expectancy has increased dramatically, and I think we'll stop here, and we'll continue with the next time. Okay, and all right, and I think so. I'll send this out, and I'll stop my screen share, stop the recording, and